It's the 7-Minute Drill, a fast-paced and fun conversation about common orthopedic topics and solutions with Dr. John Urse. Brought to you by
Ted's Authentic Greek Salad Dressing and Marinade. It's healthy, gluten-free, and delicious. You can find Ted's in Dayton, Ohio at Dorothy Lane Markets, Health Foods Unlimited, and Dots Markets. That's Ted's Authentic Greek Dressing and Marinade. Thanks, Ted.
We would also like to thank
Stifel's GWR Group combines more than 65 years of experience helping high-net-worth clients consolidate, coordinate, and simplify their wealth planning strategies. The group has access to a full suite of resources to serve all of your financial needs. Email gwrgroup@stifel.com or call 937-353-2863 to speak to Guy, Brad, or Jeff Richardson. Stifel, Nicholas & Company, Incorporated.
All right, Dr. John Urse, we're back with a special guest today. This is the 7-Minute Drill with Dr. John Urse, so tell us about our special guest.
Well, our special guest is from the Predator movie. It's a spine, and we're going to talk about the bottom of the spine today. And today's topic is going to be, is it my back or my sacroiliac? So
is it my back or sacroiliac? I can't even pronounce that right.
I know, so we're going to start right away and mercifully abbreviate that, your SI joint.
SI.
So sacrum, S.
Yeah.
Iliac is the pelvis. So where the spine meets the pelvis is a joint. There's one on each side, and those are called the SI joints. And if we look here at the bottom of the spine, so we talked before about pinched nerves. So if we look from the side, we see discs, which are sponges between the bones in the back.
Yep.
These are the lumbar vertebrae. We talked to Dr. Patel a little bit about spine fusions in the back. And then what's called thoracic and cervical, which is the neck. But we're going way down to the bottom where the pelvis, which is this thing, your hip bone they call it,
right,
meets the spine. And the sacrum is the bottom of the actual spinal column.
And that's the S in sacroiliac.
The S in sacroiliac, right.
Okay.
So at each level of the back or the sacrum, nerves come out, little openings. They go to your legs. We talked about pinched nerves of the arms and legs. They come from the spine, and they give us feeling, and they help our muscles move. If we have injuries, today we could talk about trauma to this area. Let's say you break your sacrum.
So help me out a little bit. I'm looking at this, but where on your body is this?
It's right at your top of your butt crack.
This is your hip right here.
So you'll feel your hip bone, that hard thing on the side.
Yeah.
So if you go all the way back, follow backwards, you're going to hit a place right in the some people call it the small of your back.
Is that the tailbone?
The tailbone is actually the very bottom of the sacrum.
Okay.
In fact, it's called your coccyx, which is a vestigial tail if you follow the primate evolution theories.
Sure.
So in this case, we're going to talk about why does the SI joint cause problems, and there's a few different ways that happens.
And so is this, if I am having a backache, is it the same thing?
It's real hard to tell sometimes, and that's what today's talk's about. We're going to go quickly over three things. How do we get it?
Yeah.
And why do we get it?
Okay.
What are the causes? And then, more importantly, what are the treatments? What can we do for it?
So are treatments always requirements to go see you, or is it just some...
We'll get to that. So
okay.
let's find out what it is first. And it may be hard to tell because the nerves that come at different levels can shoot pain into the low back, into one of your buttocks, into the back of your thigh. Some low back or SI problems actually go below the knee down to the outside of your leg. So you think, oh, I have a ruptured disc in my back. It could be what's called an SI joint problem. So that leads us to, how do you get one?
How do you get one? Now let's go. How do you get one?
I didn't think you'd ever ask me, Terry. So, well, certainly we talked about trauma. So you slip a stairwell
ice.
And you hit, or on ice. Yeah, we have cold weather. They're
Yeah.
playing tennis in Australia there because it's summertime, no ice, but you can still fall. So you hit your tailbone if you have a fracture, a motor vehicle accident. Sometimes the pelvis breaks. And remember, the pelvis is like a ring. So if we have rings on our fingers, a break in the front is going to cause a break in the back or an injury to the back of the pelvis. So trauma, fractures, falls, blows called contusions, those are all things that could cause injuries, any part of the body, right? So in this case, trauma is one. You should know whether you had trauma or not. The second reason are things that aren't as common, things that come from other parts of your body. So patients who have psoriasis can
You
have...
mean flaky skin?
There's 4 of these kind of SI joint arthritis conditions that are part of a rheumatologic or immunologic problem. So psoriasis, you've heard of inflammatory bowel disease, Crohn's, and ulcerative colitis.
Oh, yeah.
There's a type of thing called reactive arthritis where you get a swollen knee or you get some eye or some urinary tract infection problems. And then the 4th thing is called stiff man syndrome or ankylosing spondylitis, which is a kind of a real stiffening of the back. If you go back to your prehistoric days, an ankylosaurus was a type of dinosaur, and ankylosis means stiffening or fusing. And these people get a stiff back that starts low and starts to go up the back in early age, much like you've seen Lou Gehrig's affect nerves at an early age,
Sure,
and then
yeah.
things get bad at a younger age than you expect. So there are some lab tests for these, what are called, and I can promise you one long word at every podcast.
You gave me more than one long word already. But go ahead.
This is horrible, but spondyloarthropathy means spine and arthritis condition. So a SI joint problem that may come from somewhere else. You may have SI joint pain years before a inflammatory bowel problem, before you get Crohn's disease. You could say, my low back was killing me for a year, and then I got Crohn's. Sometimes those conditions affect other joints in the hand, and they follow the way the SI joint symptoms goes.
So if I'm sitting here today and I have a pain at around my tailbone area, that's SI issue.
It could be, and it's rare that it's going to be one of these psoriasis and inflammatory bowel problems. More than likely, it's a structural thing. You've been playing soccer and you got in a collision, and your SI joint is sprung or off kilter. So in those cases, we just go to a physical therapist, or we would go see an osteopath who does manual medicine or a chiropractor, and they can adjust something that's off to something that's back where it should be. And a lot of that manual medicine practice is meant to restore something that's wrenched to unwrench it. So you would start with x-rays like any good office visit. A doctor would examine you, a health provider. They would take an x-ray. You could have pain in your back coming from your hip. You could have something higher up in the back. If it's stretching like a nerve that's irritated, like the sciatic nerve, going down to your toes, it's probably maybe not your SI joint. It could be one of these lumbar nerves that are pinched. So again, this is where medicine is not an exact art. We try to decide where the problem is. Then if we say, okay, we've got a couple factors, you've had a red eye for these, what are called conjunctivitis problems. You've had some other things that could be part of this reactive arthritis. We could do a few lab tests for that. Not common, but if that's what it is, the test will show that. But it's more of a rheumatologist would probably order something like that, and it would be more associated with other problems in the body. So it's just the SI joint, then you stay with musculoskeletal care, which is orthopedic surgeons, therapists, chiropractors, people that do, musculoskeletal medicine.
So is these things popping out here, you're basically those are nerves?
Those are nerves, but again, the SI joint doesn't move very much. So it's a very kind of fixed joint. It does have some lining cells like other joints called synovium. It has a potential to be a real cause for pain, though. And there are times then in the treatment plan that therapy isn't doing what you want. You haven't been able to find it out. Maybe you've done an MRI. The lumbar spine looks okay.
Right.
Then maybe we start doing some things to diagnose the problem, which would be an injection. We use X-ray guidance. You've heard of these fluoroscopy units, which are ways to guide a needle into that small joint.
Yeah.
And if you put numbing medicine or some steroids in and your pain goes away, well, that's probably where it is. It's like a squeaky hinge on a door, right? So,
but is a nerve where the pain originates from?
It's probably more in the joint itself.
But so you can actually feel pain in the joint, and it's not a nerve issue.
It can be. It's a very confusing area of medicine. That's why we're spending a little time on it, because we want people to say, it's kind of. I tell people, if you look at a door, there's 3 hinges: top, middle, bottom.
Yeah.
So I call the spine number 1 or at the top. I call the hip which can cause a lot of things around the pelvis to hurt, number 3. But number 2 in the middle is the SI joint.
Oh,
so the
right.
sacroiliac, or SI, is kind of that middle hinge where, we've been here, we've been there, but did anybody ever check in the middle there? And there are ways that we've talked in the past about things like PRP, so platelet-rich plasma,
Right.
might be an option if cortisone has been done but didn't last very long. So there are some very minimally invasive ways to take care of it. And there are even some more definitive ways. So if you have a traumatic injury to it, or bad debilitating pain that has only got temporary improvement with an injection, there are times they fuse the joint. They actually stiffen it,
Right.
put a little screw across it, and that makes a stiff, painful joint a stiff, painless joint. It doesn't really move much to begin with.
Sure.
So, that's kind of the spectrum of you don't need to do much to, wow, maybe it needs a surgery. That's probably a very small group of people, probably less than 1%. So again, our Asian counterparts don't even go to doctors for back pain. There's so many back problems. They tell you, look, and there's so many people, they say, figure out what makes your back hurt and quit doing it. So we do get a little more focused because we spend more on healthcare in North America.
Right.
But again, the SI joint is one of those areas that you don't want to forget about. And that's why we did a short podcast on it.
So last question I have for you is, if I fall on the ice and I come in and boy, my back hurts right now, what should I do? Obviously you want to put heat, put ice, don't walk. Give me the recommendations before I see you.
Yeah, I think that's a great question because most of us are going to have a low back problem in our adult life from something. So the answer is rest, get a pillow under your knees, put a little heating pad on if you want. You can take some anti-inflammatories. We talked about some safe alternatives,
right,
like Boswellia or some of the herbal remedies. There are other, Tylenol is always good because it's not a narcotic and it helps with discomfort. But again, a lot of things, if they are just, you're shoveling snow, we got a lot of snow, even in our southern states in the United States this year.
Yeah.
So, if you're out there shoveling and your back's hurting, it's probably going to be okay in a day or two if you just rest it. Listen to your body going, man, I need to stop shoveling for a little bit and get a snowblower. So I think you start with simple things.
I did get snowblower.
And think about getting through your life to age 90 with your body parts. And, it's going to get better most of the time. And when it doesn't, then what do? We go to the beauty shop, the golf course, or Google, and then we finally get to a healthcare provider. So, this is a spectrum of misery. One last thing I'll mention, in pregnancy, fairly common event, the pelvis has to expand to allow for the baby to come out one way or the other. And there are times where the SI joint gets involved with patients after they've had pregnancies. So there are some subtle ways that can be adjusted with therapy or some of the manual medicine techniques.
Is that why you see some pregnant women always kind of putting their hand on their lower back?
It can be. Again, the pelvis, I tell people it's like a basketball coming out of your mouth. It's not an easy event for the whole anatomical world, but I do think you have conditions where the pelvis has to accommodate things around it, right? And baby deliveries are one.
So have we left anything off we need to let these good folks out there know about?
Probably.
All right. Well, this is a 7-minute thing, and I'm sure we've gone over, but all right. Well, this has been very interesting. I'm glad you brought a visual aid. You get like show and tell in school. You always brought the lunch box with the Beatles on it or something like that.
Oh, you're a big Beatles fan. So I do want to thank our sponsors, Ted's Greek Dressing, so tedsaladressing.com, and Stiefel Nicholas
the guys there.
The GWR group. So we're happy to have them. Make sure you like the Bone and Joint Playbook and the 7-minute drill on your favorite social media forum,
right,
and invite somebody else to listen also.
Well, so if somebody wants to reach out to you because they like what they're hearing and they need some help, how do they get a hold of you?
Well, I have a website, drjohnurse.com.
I go there all the time.
And it's got podcasts, it's got blog articles, there's information on the PRP and some of the other ways you could schedule an appointment if needed. It's a long way to come from South Africa. We are actually our podcast is more commonly heard in Frankfurt, Germany than Chicago, Illinois right now. We've got these metrics from
I don't even know what the heck I
Google's.
would do with that. I can't make a joke out of that.
I don't think you need to. I just think there's a lot of people listening. We're happy about that. And somehow word's getting around. And there are a lot of these musculoskeletal conditions. We're going to go over, I think, a really good topic on the spine next month with our pediatric orthopedist, Dr. Melman. He's going to talk about scoliosis, which is curvature of the spine.
Yeah.
And
is he bringing a visual aid?
Well, I assume he will.
Okay.
He's pretty forward thinking.
Do you have a name for this? In the office, normally they come up with names.
Most often, this is just a spine model.
There's no cute name.
No, I call it the Predator because in that movie he just ripped people's spines out. But that's basically the top of your head. We talked a little bit about concussions.
Yeah.
Remember when you bang your head? And then we've talked a little bit about pinched nerves in the neck and low back. We talked about back fusions.
Right.
Now the SI joint. We've pretty much hit adult spine problems, but there's a lot in the pediatric world with scoliosis that I think patients who have, children or adolescents with that are going to want to hear Dr. Melman's podcast. That'll be a full 30-minute one next month.
All right. Well, hey, thanks for joining us here on the Bone and Joint Playbook with Dr. John Urse. This has been the 7-Minute Drill, and we'll see you guys again real soon.